everyone, and welcome to Occupational Therapy 226. This lecture is on assessment in pediatric practice. My name is Melisa Kaye. I'll be your instructor for today. Let's go ahead and get started. This is a three-part video, and this is part one. We have three objectives. The first is to describe the assessment process. The second is to explain the necessity of each step along the way. And finally, we want to identify and explain the focus of specific assessment instruments. We're going to start general and then dig in specifically. So, about evaluations. An evaluation is the process of obtaining and interpreting data necessary for intervention. This includes planning for and documenting the evaluation process and the results. So we're talking about a whole process when we talk about evaluation. It includes an occupational profile, which you're familiar with, and also an analysis of occupational performance. This is the actual the assessment part, right? So the tests, the observations, etc. One thing that we want to differentiate between is assessment versus evaluation. So assessment is the tools or instruments that are used, and evaluation is the process. We also want to not underestimate the importance of using direct observation when clients may not be able or willing to participate in standardized assessments. So that can be very important, and it's sometimes overlooked. So about assessment. The purpose of an assessment, or the purposes, are many. To develop an intervention plan. So if we don't know how a client is functioning, we don't know what we should do to help, right? We can also use assessment to screen, and a screen is a little short assessment. To determine OT eligibility in pediatrics, it can be for California Children's Services or school-based services. So different organizations have different eligibility criteria. We can use it to reevaluate to see where a child is at after receiving some services, to document outcomes for research, or to evaluate a program, either a private practice, a school-based program, etc. There are a couple different types of assessments. There are screenings, which, as I said, are short. It's a quick snapshot. It can either give an overview of a child's functioning, or it can drill into one specific area. It can't identify a deficit, right? So it's super quick. It's a little picture in time. So we want to stay away from thinking that will actually identify a deficit in a child's functioning. And then there are diagnostic assessments. They identify a function is below age expectations, and they usually take longer to administer, up to about 90 minutes. The focus of assessment can be one of two ways, and often we do both things. The first is a top-down assessment, so we're looking at occupational performance, so the big picture, and it's effective for measuring functional outcomes of intervention. We can also look bottom up and assess the client's performance factors or performance skills, so the little bits of performance, right, that build into occupational participation. And it has the drawback of it is that it has limited usefulness as an outcome measure. So we can use it to assess, but not to measure outcomes. Let's look at the assessment process. We first formulate an evaluation plan. It's based on the occupational profile and a number of other criteria: age, presenting issues, available time that we have to do the evaluation process, and different organizations will authorize different amounts of time to do and write up and present the findings. The environment that we're working in, what priorities we have, the service model, different theories, and also what evaluation tools are available. So you can see some of these are pragmatic considerations, and some of them are developmental, and some are more overarching. The structure of an evaluation can either be individual, where I go in, I evaluate a child, or it can be a team approach. And that team approach can either be interdisciplinary or transdisciplinary. Interdisciplinary is coordinating so that each healthcare professional provides the part that they are most suited to provide. Contrast that with transdisciplinary, which requires more role release. And in that model, say a child is familiar with a speech and language pathologist, but they're not familiar with me. And I come in to do an evaluation, but I'm not going to get great results because the child doesn't want to interact with me, or is nervous about working with me, or has some anxiety, doesn't like strangers, etc. So in a transdisciplinary approach, what I can do is I can sit back and ask that speech and language pathologist, or potentially a parent or caregiver or a teacher, to do some of the activities in the assessment, and I'll be the observer, and I can guide them, and we work as a very close-knit team. All right, so that's the end of part 1. In part 2 of our 3-part series on assessment and evaluation, we're going to look at the steps involved in the actual process. All right, see you in a minute.